Morning, László.
Very good morning.
How are you today?
Thank you. Sunny day, so it can't be better, given the circumstances.
And talking about present situation, how do you think what we are going to expect in upcoming months?
But I think that's not even a $1 million, more like a $10 million question, because industry may want to do certain things, but you are so much exposed to governmental actions that it's almost impossible to plan. And as you can in many countries, it's just you just can't plan even weeks ahead, let alone months ahead, because governments may choose to do certain restrictive measures, and that's literally making even midterm planning impossible. So we can have scenarios and we can have visions of what may happen, but the government instantly chooses to close borders or introduces some lockdown, and all your plans are, going as smoke. So sadly, we don't quite know what to expect. We all, I think, can anticipate that the traveling parties, people are polarized. Some really would love to go as soon as just physically possible, because they're really missing what they like doing for years or decades. Others can be really scared or worried because, again, governments may not transmit the best messages, and a lot of scaremongering is taking place. Media is creating hysteria in many instances, and I don't mean by any meaning that I belittle the risk of the situation, but media always looking for some big numbers and some scandals and some terrifying issues. So certain segments, maybe elderly, could be really put off of traveling because they're worried, quite rightly, in certain instances. But in other cases, it's saying that, well, it makes very little difference if I'm at home or somewhere else, because everywhere there is this thing. And you have that risk of you may be infected literally anywhere you're going, even going down to the shops. So why would you bother be worried? Where would you be more worried to go to a different country? So it's very, very mixed, and it's really probably the worst part is that it's impossible to plan. Even when you have 5 scenarios, 10 scenarios, there's always the major issue, which is, what's the government going to do? And what's the government going to do in the country that I'm planning to go to, and as well as in my home country? Yeah, that's what the airlines are really complaining about, that it's impossible to plan. Tour operators, and quite rightly the facilitators, saying that we just can't plan. And who is standing should there be a cancellation? Who is responsible? Imagine you go for a treatment to a country, and during your treatment something happens and you can't go home. Then what? Who is responsible? Who is paying for that? Insurance is not going to pay for that. Are you going to be rescued home? Or what exactly is going to happen to you? So often you say that, if it's an elective intervention and it's not urgent, I can wait. That's if you want to have a dental appointment, unless it's terrifyingly and terribly painful, you can say that, that's fine. I would love to have my teeth done now, but that would be perfectly fine in 6 months' time.
Mm-hmm.
Hoping that your dental clinic still will be running in 6 months' time, because that's certainly an issue that your dentists may not want to sit and wait for 6 months. They may look for other things to do, and there won't be a clinic in 6 months' time.
Yeah. So, and how do you see the impact that's already happened to the market, to medical infrastructure and medical companies around Europe and in Hungary also?
Well, I think we can't have any good news here. We can see when we talk about hospitals, obviously, especially state hospitals are literally cut off from anything but being ready for any kind of pandemic treatment. And no surgeries permitted. Everybody's waiting and hoping that it will not have major impacts on the actual patients. Something is not urgent, then it's postponed. The private ones are, certainly some of them are focusing on preventative measures and tests, and others is just closed. When you don't have patients, then it's done. If you look at the thermal or hot spring business, which is important in many countries, and especially in rehabilitation and sanatoria, the market disappeared, or you might have had it during the summer, but now the balance of guests is totally out of literally balance. Sorry about the stupid example that way, but most of these facilities would have a sizable chunk of their demand coming from a foreign country, maybe just a neighboring country, doesn't matter. Mm-hmm. But even domestically, people who are not living where the services are. And now, because of all the worries and someone like to have the lovely breakfast in the hotel and then the buffet dinners, that's gone, that you don't have any of those anymore. We are talking about touchless treatments, and especially in the wellness part or in the hot spring business, the human touch would be absolutely essential. And no one really wants to be surrounded by people who are wearing these protective outfits, because it's just not pleasant, that your state, you got agitated and you think, God, it's terrible, I don't want to do that. So I don't think we have any good news here, sadly, absolutely any good news. And yes, people say, oh, well, that's wonderful because everything will be going in digital. I said, yeah, I find very difficult to have a digital mud wrap. Either you have a mud wrap or you don't have a mud wrap. You don't have it digitally. You don't have it on Zoom. That's not physically possible. You can have a consultation, but you can't have massages. You can't have
treatments,
body treatments. You just can't do it. That's just not physically possible. So all that staff who used to be doing that, obviously they are jobless. The enterprises or organizations providing services are without any revenue. They are laying people off, and those people are highly skilled, and they may go somewhere else. And should there be 6 month time, whenever any kind of rebounds, there you won't have skilled staff anymore. And governments may or may not provide bridging funds for organizations to, not even 100%, but to provide something to those employees who are essential in this business. Private companies, most of them cannot finance months and months and months of no revenues and full-time staff. That's just, again, not physically possible or financially possible. So it's an absolutely tragic situation, if you ask me.
Okay, but maybe you can see and you observe some success cases, like success stories of companies and clinics that are somehow solving this issue, like consultations digitally from Zoom, Skype, or any other platform with some lessons from some examples.
It very much depends on which specialty we're talking about. If you talk about rehabilitation, yes, you can do physical exercise remotely, because all you need to do is follow the therapist.
Yes.
That certainly is a possibility. The question is, 70-year-old pensioner going to a rehabilitation center would be ready to log into a Zoom session with his or her therapist online? And if you ask me, I very much doubt that. Younger generations, absolutely. So, because for many segments, the social experience is as important as the physical benefit. So you're talking to like-minded people, you're surrounded by other pensioners, you're surrounded by therapists, you have a social environment, not just being on your own at home because you're widowed, for example. So we are dealing with a serious mental health challenge because people don't have any social relationships. So yes, you can do that, but of course, dental work is not going to happen. Plastic surgery is not going to happen. So anything that wouldn't require technology, as in equipment, wouldn't require invasive interventions. Those things are out. This just can't replace them. When you have non-invasive interventions, which are, let's say, body manipulation, exercise, mental health exercises, consultations, yes, that certainly is one element that can be provided, but many of those are often only on part of the actual package. So you have the invasive and the non-invasive. Having only the non-invasive, then you probably wouldn't have traveled anyway, because you can have it at your own home in a way, unless you wanted to do it in a lovely environment in a remote place. It's a lovely forest or lake or sea or whatever it is, which you can't do at the moment. But certainly you have you can join in yoga sessions, you can join in meditation sessions online, you can do all that. But also don't forget, when you have your family at home, the privacy, it can be a major challenge, because you may not have any privacy, and it's not an easy thing to do, whichever yoga session, when you have all your family around you. It's just not, again, you can't do it. And the weather is getting, we're getting in autumn in Europe, and soon enough, it's not the time to do things outside because of the dark and the cold and the rain and the snow and everything. So as long as we're talking about something non-invasive, something which you may do anyway, that's certainly an opportunity. We know that people expect some sort of social experience, and you can get it online to some extent. But I don't think you can replace it, and all the fantastic digital options. I'm very curious about the longevity of those digital options. When you do it, are you excited? And it's a new platform. It's fantastic. Yes, I can do that. But after 2 months, 3 months, it's like, it's just another. I'm working on a computer, one might say, and then I would need to be relaxing on the computer as well. I don't want to do it. So you can have the digital overload when people are working remotely and working from home, and now we even tell them that you have to do leisure digitally as well. I have some serious doubts about that. I understand that that's the best we can do at the moment. That's fine, yes, but I think people will find it very difficult to cope with that in the long term.
Okay, but let's imagine that. Let's agree on that this situation is going to last for several period of time. We don't know exactly how long. And somehow these companies who are providing health services and wellness, they need to survive. And they need to survive the loss of patients during some period of time. So maybe there can be some kind of cooperation between these companies, wellness and health sector, and IT companies going digitally. I agree totally with you that it cannot replace the exact connection between doctor and patient, but maybe there could be some options of cooperation between the digital world and the real world in this period of time. Something beyond maybe even just consultations that could help to survive this period of time. And maybe, again, we're saying that digital is like a part of our time in our lives, and then we should go socialized and live in the real world. But at the moment, we are forced or to sit at home or just stay connected 24 hours. Could there be any initiatives coming, or maybe you know about such, to connect these two worlds between and come with some ideas, insights, like for psychological, mental, and maybe even physical stabilization during this period of time. Could you see the availabilities of this cooperation, like maybe in a form of clusterization with different types of companies, just for like surviving the pandemic?
Oh God, that really is a very, very difficult question here. And when you have a clinic or a hospital or some sort of healthcare facility, when it was designed, built, managed to look after travelers and foreign patients, which we do have that in many aspects in Eastern Europe, and especially in dental, plastic surgery, IVF, various special healthcare domains, those cannot be replaced. That's just not happening, and I'm very skeptical about expecting everything going digital. Maybe I'm the only one who believes that not everything should be digital, because that alienates people. And I think we are human beings, and human beings are very social by DNS or DNA, and digital is everything but social. We understand social media, but social media is mainly a terrible amount of stress to a large number of a large chance of the population because of the trolling and all that. So that has its own risks. I think the only way out of this, even we have lovely online solutions and sharing readings of your mental and physical state with your clinic, and that's providing with dietary, exercise and whatever recommendations, and you keep contact with that, so you are exchanging data and exchanging recommendations. These are all desperate measures, and the governments will need to recognize that they would need to lift the travel ban. That's no other way to get over this. Just not going to work out, because you can't have as much solution because of the invasive nature of medical therapies. And don't forget that many people would be willing to join in a program online, whatever that is, for some time. But the whole idea was that I would go to this sanatorium, go through the series of treatments for the next 1 week, 2 weeks, 3 weeks. So I'm dedicating my attention, my time, my interest. Whereas when you're at home, you would have, I just had a phone call, so I'm passing on this exercise, I'm not doing this. Oh, well, I just make a soup, therefore I'm not going to do it. Oh, well, my just son doing this and that. So you always have distraction. Whereas when you go on a trip for a dental implant, for an IVF, you have your very dedicated motivation that this is what I'm going to do. This is the whole trip. Whereas when you're at home, you always have some other issues, your distractions, and the fading away. You can see what happened to the popularity of wearables. That all these measures, all this equipment that they check your number of walks a day and your heart rate and all that stuff. The longevity of those is actually very short, because people get bored of it and they say, well, there's just another nuisance that I need to put up with. I think what we really need is, humankind at the moment is way less digital and not more digital, because we need social interaction, we need access to nature, we need private time, we need, but private, not online private, but private when people are locked down and you don't have any privacy at all. And you lose friends, and then you lose even family sometime, because you can't see them or can't meet them, and the frequency of Skype is getting less and less frequent. So I'm not a massive fan of having everything digital. There is are certainly a way in which digital can help. When you have access to big data and can help you to find the best treatment for you, that's absolutely fabulous, because you can't do it otherwise. So you have access to experiences, previous cases, consultations, remote, let's say, physicians who can help the local physician to do something, but the person wouldn't need to travel. So there are all sort of ways that could really, really help and could be really beneficial. But pushing everything what we can, even just for desperate measures on the digital platform, it's, I don't know, to me, it feels like it's just a desperate attempt to do something, because I keep hearing that everything must be digital, so I'm doing that. But I'm not so sure that the impacts are there, because we glue people even longer, even more, to a lifestyle which is not good for them. Sitting is itself is what we call the cocaine of the 2020s, just because you're sitting even more. Because you shouldn't be sitting, because you have all sort of physical, mental, and all sort of consequences. So telling them, oh, you do even more digital, that really is a bad message. Yes. I'm sorry, I can't give you very positive notes on, oh, go everything digital.
Yeah, but these days, digital gadgets like wearables and mobile devices, you should not sit. You can run. You can go hiking, running, making some exercises that can be monitored.
But those gadgets helping those who are active anyway. So those people who have been running and will be skiing cross-country skiing in the Baltics, and going to cycling and picking mushrooms and all that stuff that you have been doing, these equipment just help those who are already active. I haven't quite seen people who haven't been active just because they have a wearable becoming active. That's a very, very small fraction of the users. So it's those people who are healthy can stay healthy, or can get even more healthy because of the gadgets. Those who really would need it or would benefit from it, they wouldn't. You need government policies. You need corporate policies, local municipality policies to change the way in which people think. And they're already glued to the screen and already glued to whatever they are watching. And we would really need, in this time of period, especially, governments are not just scaremongering population, but tell them that, well, you need to do things, that you have your own responsibility in your own life of physical and mental. And these are the exercises that we recommend, even you're at home and you can't go out, or just have a walk. And yes, we understand this 10,000 steps thing, which have nothing to do with anything. It's coming from Japan a good couple of decades ago, when it was a government policy and said, oh, well, there would need to be a round number which we can communicate to the local population. So they say, oh, well, you know what, why don't we say 10,000? So that's what the 10,000 is coming from. It doesn't have a clinical evidence. There should be 10,000 or 12,000 or 8,000, but still is a good enough number. So having some easy recommendations to population, that would make a massive difference, instead of just hearing that, oh, we have X number of new infections and X number of new casualties today, and that's what people hear, and then even scared to go to the shops, even scared to go out to the streets, because, oh God, what's going to happen? So we need to, probably already have got used to some safety measures of keeping distance and cleaning keeping your hands clean and disinfected and all that. So people get used to a new norm as such. But then people say that, especially grandparents, that I'm not going to miss hugging my grandchildren just because someone says I need to keep distance. What life is that? I don't want to do it. And best friends and all that. So we have all these fantastic new norms created by desperate measures, but humankind is I don't think is the kind that's going to cope with many of those, because you just can't do that, because you may not have the physical risk, but you would have the mental risk because of the lack of human contact and the lack of human relationships. So I think the governments have tremendous responsibility of creating that balance and facilitating that balance. Otherwise, we will have issues for the next 10 years, not just regardless of having a vaccine or not. It's because of mental consequences of what's been created in the last, let's say, or 10 months or so. And we will need to release the borders, especially within the, let's say, the EU as such, and also cross-border, because that's how we have been living in the last, how many, 2,000 years? You know, we have always been doing trade, we always been doing business, neighboring, people coming and going and exchanging. And the trade can stop, and then everybody would need to forget coffee. And always said that, oh, well, keep your local business going, so buy local products. I said, that's very nice, but, you know, in that case, in the Baltic countries and Northern Europe, you drink how many coffees a day? Forget it, don't drink coffees, because that's not coming from the local market, so it's rubbish. But there's, again, government responsibility. And I honestly see very little evidence that government actually knows what it's doing. It's desperate measures of balancing between this and that, and the population is just, you know, being thrown from one side to another and trying to cope with what's happening. And we now see the mental health issues, the depression, the even you know, standing against, saying that I had enough of that, I don't care, because I miss this and this. And of course, no one is talking about, oh, I'm missing my dental implant, because it's not the first on your list. But they said, well, I want to live, you know, we have the one life, and now we don't see, as you said in the very beginning, we don't see the end of this at all. You don't say 1 year, 2 years, airlines are not flying till next, international flights not flying till next July. And then what? You know, airlines are getting rid of aircraft, so capacities will not be back for many, many years. That's tremendous. And what are we going to do with the hundreds of thousands of people who lost their jobs? What exactly are we going to do? In leisure, in recreation, in healthcare, but healthcare not in hospitals dealing with pandemic, but telling those who are in the elective healthcare business, what exactly are they going to do? What else? There's no options.
Okay, but like we say, when in a time of crisis, some window of opportunities opens. Yeah, would you agree that in these days, these times, business should be involved in enlightening people, in communicating the importance of self-aware of what people should do by themselves, not only waiting for the measures of government and be frightened of this infodemic all day long through TV and other media? Should people and businesses get involved with some mind shifting for people, not just waiting for some people, World Health Organization or some other, to come and to solve their problems, to resolve the situation? Because as we can understand, it will be not so fast or even very effective. So what can we do by ourselves, and what businesses can do in this window of opportunities?
Absolutely, I believe you're absolutely right. The self-responsibility and being responsible of what you do and how you live, that should be a major objective here. That clinics, hospitals, spas, wellness centers would communicate with their guests, assuming that they have access to their guests, at least some of them, that, guys, you have your own role in all this. You can do things, even if you can't come and visit us, we can help you because we understand your issues. And we can help you with various recommendations, as we say. It can be food, it can be mental, it can be exercise, it could be healthcare tips, it could be eating, it could be talking, it could be listening, all sort of recommendations, all sort of actions, but that requires the businesses to step out from their usual comfort zone. And they say that, yes, I used to be a clinic for, I don't know, dental care, healthcare, IVF, skin care, rehabilitation. Obviously, I can't have my patients, guests at the moment. So what is it I can offer to them, and what channels I can do that? Is it going to be a YouTube channel? Is it going to be a direct message? Is it going to be a group, a closed group that we're discussing issues, and we have our on-site rehabilitation specialist giving you advice, or you can ask the person who is available today 10 hours and everybody can ask questions from the person. Not providing treatment but available for consultation, or we are going to give you health tips in terms of what to eat and drink and how we can help you with sleeping, and we help you with sharing our favorite music that we used to listen to in-house, and we give it to you so you can listen to it before you go to bed. That certainly requires a very different approach, and private organizations can do that as long as they have their own staff ready to change the way in which they work, at least temporarily. That certainly is one way of trying to get out of this, but. And you can do that in certain specializations, but when you are laid off, because that's by now, this is what's happening, that companies are laying off even specialist staff because you don't see the end of the challenge. So you know what, I talk to you in 6 months' time. Then the short-term survival, or even the long-term survival, can become the major objective of that organization, and less so of talking to their patients or guests. And well, yes, we heard that many of the dental clinics that, for example, in Hungary, who have been exclusively focusing on international patients, will never reopen. That's finished. End. And that's certainly not an exception. It's not a one-off. That I can very much imagine is happening in other countries as well, because you just don't have the patients and you can't keep everybody on payroll. And if you have your persons, subcontractors, they just go somewhere else. It very much depends, to me, on the CEO or the leader of that clinic or hospital or whatever place we're talking about, what his or her visions are, and how the person sees the future. And you say, instead of doing treatment, you do some CSR work, and you do provide something for the local community. You used to work for international patients, but now you will do something for the local community instead, even pro bono, or you just help with the local schools and do some other CSR activity, because that's what you can do, and you want to keep your people busy and you want to keep your people active. You don't want to lose them. Or you do service development and treatment improvement. As long as you have some savings, then you can certainly do that. I think the Bogatin and the clinic in Zagreb, they do both of those. For example, they do provide the training as well as the CSR work, although they were 100% or so attracting international patients so far, but now obviously they can't. So you do have a couple of examples, but especially in specialties where it was a mass production, and I'm talking about mass production in plastic surgery, dental work, that's mass produced. And I'm not talking about the orthopedics or heart or any other field, because it's very, very personal and the volumes are very low anyway. Those mass produced, many of those will not survive. And as soon as the borders are open, you have new subcontractors and you can restart again. Hoping that you haven't invested into infrastructure so much that you cannot bridge the period without cash flow, because the bank may take your clinic because of the heavy infrastructure investment lately, which is, again, in certain interventions, you need to do a regular, quite expensive equipment purchases.
Yeah.
And that's now because it doesn't make, you can't use that dental chair for any other purpose. You can rent out a hotel as a student accommodation for 6 months. That's a possibility, but specialist clinic you can't use for anything else. That's a healthcare facility. You don't have the license to do anything. So yeah, you do have some creative options here, and but again, if you're owned by a municipality, which in Eastern Europe is not unusual, or you're owned by a state body, which again is not unusual, then your creativity is very much limited to the ministers or the ministry's boundaries, because they said, oh, well, I need to cut budget and I'm not interested in your great ideas because we need to cut budget and we need to fire people. In private enterprises, obviously, there is more room, and then we can see a couple of interesting examples. That's why I said all the CSR and all the various other things that you provide and then you help. But Eastern Europe, in that sense, it can be very polarized because of this the involvement of the state or municipalities as well as the private businesses. So it's turbulent times, and it's very equipment heavy. Don't forget, you can decide if you're working in the holistic side of the business, you can travel. That's not, you don't necessarily need to do your business where you are right now. You can go to somewhere else. But when you're much dependent on infrastructure and equipment, you cannot travel. You cannot move this away. You cannot shift your dental chairs to a different city. You cannot shift the thermal facility from one city to another city. It's there, and that is the problem with that. Many of the great digital solutions, they're not location dependent. You can do it from anywhere, and you can do it almost any time. Whereas healthcare is, especially certain parts of healthcare, is very human resource, physical human resource, as well as infrastructure dependent. And this is when you have limits to which how much digitalization you can do, or how much even creative solutions you can do, because it's you can say, oh well, why don't you do let's say an exercise session with us, and we do it in our lovely treatment or lovely exercise room overlooking the steaming hot springs, and you do it in your living room. That certainly is one way of doing that. But you create, apart from create some good opportunities so people can get and do some exercise, if we say, oh bloody hell, I wish I was there, because it's just not the same. So, but that's where you can keep people aware that you're still open, you're still working, you still wait for them, you still expect them to come back, and hoping that 6 months time, whenever we can welcome you in this room again. So you keep contact. You can put all those sessions alive, or you can put them online and anybody can access them anytime they wish. So you even provide an opportunity that a wider audience can use it, not just the ones that used to be at your place. That certainly is the case, but you still don't make any money. So you can do a lot of things for free, but I really would like to see how many % of your former guests or patients would pay to have access to those half-an-hour exercise sessions that you put on YouTube. I really would like to see that. I wouldn't be surprised it's 1 digit.
Yeah, but let's agree that and finalize with that our conversation that situation is changed dramatically, and probably the life will not be the same as it was before the coronavirus, and businesses need to revise their strategies, to revise their goals, to make some hard job to keep in touch with their clients and to maintain their clients loyally to these businesses for like hoping that someday the lockdowns will be over and they can return to their beloved spa centers, trusted clinics, and so on. And businesses at the moment can do nothing more, mostly when trying to maintain this connection, do some things like we said, just even pro bono, making some suggestions, some consultations, some information packages, how people can work with themselves in their own environments. And maybe even people would agree to donate that, not just like paying a subscription, but if this content will be useful and companies would come up with or socialized initiatives and create an image with business who really cares, people would agree maybe even to donate freely for these companies to survive them until the pandemic is over.
Yeah, I think that's all true. What we really need to expect is that, let's say, number one, people would need to recognize that there are certain responsibilities which they might have avoided so far. That could be social responsibility, personal responsibility, financial responsibility, which they didn't even think about necessarily. So they recognize that I need to be aware that my business, what I give to this organization actually helps them to keep them afloat. So that's a responsibility thing. So not just carelessly do whatever. That's certainly one thing that the awareness could be better. Companies, organizations providing healthcare services do need to think about, and they have been thinking about, of how to keep the momentum live. So keeping contact with their guests when they cannot come. And I'm not talking about Instagram or not talking about the easy peasy sharing photos that we are waiting for you sort of messages, because that's brilliant, but everybody does that. But more like providing some meaningful content. And the responsibility comes in here as well, because then people would need to look that up or take part of it, what that service provider has been recommending or sharing. And they recognize that there are other ways to get the involvement going and how to expand the services which they provide. As you know, the service level planning has 6 or 7 layers of how you dress up a certain service and what would keep people away from buying that service. And now this situation where no one is there, you really need to be able to identify of how we can provide additional aspects of the very same service that would keep the attention of the guests, as well as keep the intention to visit next time. So certainly it's putting a massive pressure on the service providers of how to revisit their service approach or treatment approach, apart from just giving hands-on treatments, but what aspects of it we can replace, even temporarily, and still provide somehow or somewhat similar experiences to our guests. So you do need to be creative enough to come up with alternative solutions. Still, the question is, do you have the intention to do that? Do you have the human resources, financial resources to cover all these lovely new ideas? And can you survive without actually having guests? That's comes down to that very simply. That's how many months you can survive without having guests. And so far, 95% of your patients were coming from abroad. Then what? You can have the best creative ideas, but it comes down to financing your debt, financing your infrastructure, financing your human resources.
Yeah.
And at the same time, you can think of alternative ideas of what to eat at home, so your teeth can be even more cleaner, not just dental work, but do an apple in the afternoon because that helps to clean your teeth, and all these fantastic wisdoms. They're all very nice and certainly are beneficial to the guests. But the challenge really is, can you cope with having no guests and patients? Can you convert the local guests to your patients? That certainly is another way to look at it. That I was very much focusing on foreign guests because it was easy. I had my contacts and they could send the guests to my place. That's very good. But I didn't need to worry about acquiring local guests or local patients. Can my services be attractive to the local guests? So not 5% would be coming from local market, but 30%. One of the major hot spring destinations in Budapest, 94% of their guests were foreign. And you can imagine how many of that they still have.
Yeah, crazy.
Zero. And they are laying off hundreds of employees. I mean, hundreds. Because you can't instantly convert the local market to become users of that place, because it's financially, the tickets and everything, they were all geared for international markets. And 20 euro entrance is not something that a local market can afford, especially when they're worried that they might lose their own jobs.
Yeah.
And you can't do a thing, and everybody's super desperate and running like crazy of what to do, of survival, apart from closing the whole place down. So, it's very much case by case scenario. Let it be medical, let it be wellness. What do you suggest to someone who wants to have a baby and you wanted to go to your IVF? You can give fantastic tips about, eat this, do that, think this way, so you are getting physically or remaining physically as good as you just can. But that's a desperate measure. The person becomes even more stressed and even more desperate, because the time is ticking. In a situation like that, time is everything. In IVF, you can run out of time. And, 1 year could mean that you may not have a child ever. So your fantastic tips about how to go to bed and sleep, they don't give a damn about it, because they have way more difficult issues. So I personally don't think that we can have general recommendations as such. It's very much case by case, clinic by clinic, place by place, physician to physician, spa to spa, of how to react and how to negotiate. Yes, we can see interesting ideas and creative solutions and recommend online and equipment and all that. But looking at the industry, as a whole, I think we have some tremendous challenges coming up. Not just now, it's more like in a year time, when we recognize that we lost the highly skilled human resources. We cannot finance it anymore. And the governments may not, when they let the vaccine there or whatever is there, people say, oh, wonderful, the problem is over, go back to normal. but the implications of a 10-month close period will be here for a long, long time. And then we will need the measures, and then we will need the creative solutions of how to keep the prospective guests' interests, because they will be very much busy with their very own survival. But people will travel, that's no question. As soon as it's physically possible, people will travel, because if finally, I want to go here, I want to go there, I'm missing this, I want to try this one, I look at my hair, look at my nails, look at my teeth, look at my breasts, see, I really need to have the new Botox, and look what happened to me. So people will instantly travel, those who can afford it, obviously, and not worried about the voluntary treatments will come back, because you do want to have whatever thing being done, because you wanted it anyway. The elective ones, the other ones which are not essential, people may think twice. Not because of the risks, but more like because of the financial risk, because of the livelihood risk. Well, that would be a great idea. I would have done it, but my job is on the line, my livelihood is on the line, and we need to save money. We need to be more careful about spending. So dental work will come back, and plastic surgery will come back. People will be vain, and they want to look better, so that even after being locked down, the terrible example is that you never seen a politician having bad hairdo, even if the hairdressers were closed, theoretically. But you never seen one with a terrible hairdo, so obviously there were some exceptions. Because that's what it is. And now people will say, God, look at me. After all those many months of not doing anything, I want to look young again. I want to look healthy again. I want to visit the sea. I want to go to the mountains. I want to see family. So probably that will be a very quick rebounds. But how sustainable that is, that will be another issue again. So people, organizations would need to really know better the audiences and not rely on just the mass market. I've always had dental patients, so I don't need to worry about it. There will be another one. You really need to understand what the really trigger points of those guests really are. And when you said, oh, well, my rehabilitation center was very much based on physical rehabilitation, you might need to change, and you need to think of mental rehabilitation next year. Still add on some physical components, because the mental state is not independent from the physical state. But next year, probably people will be more worried about the stress, about the loneliness, and various other issues. So facilities would need to react that the society is changing, or at least temporarily shifting priorities, and you need to provide safe environments for family groups, that people want to spend time with their families away, but you need to create compartments for 6 people or so, in terms of dining, in terms of spa treatments, in terms of whatever it is, because that's what people want to spend time with their families, and less so some others. But you don't have treatment spaces for 6 people at the time. You have either individual or maybe double. You don't have 6. What do you do then? So, when we talk about, digital, but you also need to talk about how to react to this, given its physical characteristics of how people want to spend the time now. Or is it feasible at all to have the larger distances between beds and tables and all that? Is it going to be economically working? Can I have enough guests to do that? Because you can't necessarily increase the prices at the moment just to overcome the lost revenue, because people may not be happy to pay more. So there's a lot of challenges which are service, which is of infrastructure, which are layout in terms of communication, guest knowledge, product development. So it's all there when we started with the paradigm shift or not. that has very is large number of aspects to it. So it's certainly, if you look at it from that perspective, exciting times, because you do need to change, and do need to and have to and must change at the same time. Whereas before you could have if you wanted to. Now it really is, you're forced to do it.
Yeah, and it's simple like that. You need to change or you just disappear. So probably having kind of this time. So, okay, László, so let's wish businesses and our colleagues like creativity and intention to make some changes, look for changes and dare to make changes, not awaiting when governments are going to come up with some proposals and some decisions. So
let me add one thing, if you don't mind, and that is, I think everybody's webinared out in the last 6 months, if you can say that. You know, you have been to, I mean, not everybody obviously, but and fantastic wisdoms you can listen to from this person and that person. But I think what can make a difference is to help the personal mentoring to your business of how to do that, because you can listen to some great wisdoms and recommendations of do this, do that, but how to do it,
how to adopt
for
it
a clinic, how to adopt it. You would need to do a lot of hand holding with certain enterprises. We do that with a couple of accommodation facilities, spas, thermal centers, or even travel agents. And I know, and you know, I know personally how difficult it is to get the message through and make them understood that this is not just a one-off thing, but we need to revisit your whole service options, how you talk about it, what you do, how you react, and how you communicate about it. So you need to do a lot of adoption and adaptation, and that can make all the difference, if you ask me, in terms of giving a proper and valuable help. And I think that should be one of the main messages, even today, that we're discussing this, that businesses would need to be ready and able to take this mentoring, hand-holding recommendations, because otherwise they will find very, very difficult because of the daily challenges. So do that and look for it, and take that advice, even if it costs a little bit of money, because that's not a major issue. But you would take it even more seriously if you paid for it. That's how it goes. Free, no one takes free advice seriously.
Yeah.
When you paid even just for 20 euros for it, you take it even more seriously, because I paid for that. So I would really recommend everybody who listens to this that do look out and do look for mentors who can help you, even just walk you through with the challenges and options and examples that you might like some of those, and then can help that person. That person can help you to even keep you on track and look for the valid alternatives that's good for you. So I think that's a very important thing, that don't just listen to some great advice, because then you may need some help of translating that and adapting that.
Thank you so much, László. Thank you for mentoring this discussion and sharing your insights and ideas. It was a pleasure to talk to you. I believe someday we'll meet eye to eye, not digitally, but in reality. Thank you again, and I'm waiting to see you soon next time.
Thank you, much appreciated, and be well.
Thank you.
I think that's the best we can do.
Be well and be safe.
Yes, thank you.
See you.